Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Your eyes may be the window to your soul, but your mouth may be the window to your overall health. What your teeth and gums are saying may surprise you, so you should listen carefully. Today we'll learn about all things dental, from common issues that older folks face to some signs to watch out for. Welcome to this episode of Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Sarah Medley. Stay tuned. Welcome back. I would like to introduce my first guests on today's show, Dr. Sean Melton and Tammy Jones from Melton Dental. Sean and Tammy, welcome to our show.
Thank you. Thanks for having us.
So let's start with Dr. Melton. What are some common things that happen to a person as they age?
Well, there's a certain amount of wear and tear, that goes on as we age, and in the mouth in particular, things of concern could be either thinning enamel or on the teeth themselves, or loss of the bone that support the teeth.
Okay. And then Tammy, you are a dental hygienist. Mm-hmm. So talk to us about the types of training that you have to receive in order to become one.
Well, before I became a hygienist, I was an assistant and a lab tech for 15 years. But you don't have to do that. There's everything from anatomy, physiology, microbiology, pharmacology, psychology, because you're dealing with people. It's a pretty well-rounded science background.
Very good. Should folks take care of their teeth and their gums any differently as they age?
Just have good oral hygiene all your life. That's always a good thing. Try to brush at least twice a day. Use some kind of floss, tooth picking. Water picks are really good. They're making a comeback. Anything that keeps your inflammation lower is not only good for your mouth, it's good for your heart health also.
Good. So Dr. Melton, should folks see their dentist more often as they age compared to as when they're younger?
Well, yeah, patients should probably see their dentist, according to their dentist recommendations by their individual needs for dental conditions or medical conditions. We found that many of our patients that are over 60 benefit by being seen, 3 and even 4 times a year. Just you can keep closer track of any dental conditions that might come up and catch them and treat them earlier. But it also allows us to identify some medical conditions that might come up in a shorter interval and get them referred out for further diagnosis.
Good. So dry mouth. It's my understanding that as we age, we experience dry mouth. Is there anything that people can do to alleviate it? Yeah,
the easiest thing is probably just staying hydrated, getting enough water, and then trying to stay away from any diuretic type drinks like tea, coffee. I kind of lost my train of thought.
So dry mouth is very common, I'm assuming, and it is an issue that I think we all deal with. I know sometimes I will suck on a lozenge, for example. Is that something that helps some people?
It does. There are many over-the-counter products, either oral rinses or sugar-free lozenges that can help alleviate those symptoms.
Very good. Okay. So I'm going to switch to Tammy. And we're going to talk about teeth grinding. So many people grind their teeth at night while they're sleeping. I happen to be one of those. And so what can we do to prevent that? Anything?
Not really is the short answer. You can't really prevent it, but you can mitigate it and you can treat it. A lot more people grind than are even aware. And it's kind of counterintuitive for someone to go, well, I don't grind my teeth, because they're asleep when they do the majority of it. Yeah. But the signs are really unmistakable. You lose tooth surface, you get wear facets, abfractions, and you lose quite a bit of tooth structure, and you can crack teeth more often and then need crowns. So a good night guard is a really, really important if you have that habit. And it's also got more and more, it's coming to be correlated. A lot of people that have sleep apnea, which is becoming diagnosed more often have an accompanying brexing habit. So it's important to get it diagnosed and treat it.
Absolutely. So you mentioned a word there, Brexan habit.
A brexing habit, grinding their teeth.
Ah, okay, very good. So for our viewers, that means grinding your teeth.
Yeah, there's actually two portions of it. You can grind like
Okay.
that,
Okay.
or you can clench, which is more of a movement. Your teeth are set together, and you're doing this.
Very
You're asleep.
good.
You don't know.
That's right. And it also causes, I'm assuming, some headaches and maybe some jaw pain as well.
Tight jaw in the morning, headaches. You do it more in times of stress.
Okay. And then the night guard you mentioned. Do patients have to go to a dentist to get a night guard?
You can try some over-the-counter ones. Some people get some relief from that, but the best one is a custom-made one that's designed for you with impressions in your mouth.
And that's something you would get from
At a
the
dental
dentist.
office, yeah.
Absolutely. So while we're talking to Tammy, can we talk about teeth becoming loose as you age? So in the few moments we have left, can you start off the conversation talking about teeth becoming loose? Is that common?
I don't think teeth become loose as we age. Teeth become loose because there's something wrong. There's an underlying cause, whether it's a disease or a condition, bone loss, periodontal disease. If someone has loose teeth, other than little kids losing teeth and getting their permanent set in, they need to go to the dentist because there's something wrong and they need to get it diagnosed and treated.
Excellent. Well, we're going to have some time after our break to talk more about the loose teeth topic. So thank you for your answers. And as your teeth and gums age, there are some conditions you should be aware of. Stay tuned to learn more about what you should look for.